Good evening. My name is Elliot Gilter. I'm a Master of Social Work student at Rhode Island College. I am pursuing a career as a licensed therapist specializing in the care of transgender youth and their families. I'm here today in support of Senate Bill number 480, banning the practice of conversion therapy with minors. I am also a transgender man who has been subjected to 2 different conversion therapists here in Rhode Island when I was a sophomore and junior in high school. My hope today is that no other soul has to experience such a painful experience ever again. There may be other people who stand up today and give testimony opposing this bill. They may state that there is no evidence that conversion therapy is harmful. They may also state that conversion therapy has been proven to work. I'm here to tell you, based on my systematic review of reputable research, there is credible evidence. There is no credible evidence that it works. However, there is compelling evidence that it does not work and is incredibly dangerous. The American Psychological Association has released statements saying that not only does conversion therapy lack any actual proof that it works, but it is proven to be harmful and traumatic and only works to instill depression, guilt, helplessness, shame, social withdrawal, substance abuse, stress, self-hatred, and a dramatic increase in suicide rates. Practicing therapists are expected to follow an established code of ethics set in place by their national professional organization. These codes are there to protect not just the therapist, but most importantly the client. In fact, in Rhode Island, practicing conversion therapy would violate the code and law registered licensed social workers. The therapist's job is to provide support, embrace diversity, challenge social injustice, and practice brutality. Using a form of therapy proven to cause harm would not be endorsed by any reputable ethical organization. Currently, the organizations that publicly oppose conversion therapy are as follows: the American Academy of Child and Adolescent Psychiatry, American Academy of Pediatrics, American Association of American Family Therapy, American Counseling Association, American Medical Association, American Psychiatric Association, American Psychoanalytic Association, American Psychological Association, American School Counselor Association, American School Health Association, National Association of Social Workers, Pan American Health Organization, and Just the Facts Coalition. Even the American Association of Christian Counselors included in their new 2014 Code of Ethics, Section 120F, in regards to working with LGBT people. This code states that the practice of conversion therapy is not condoned, and that it is known to cause anxiety, depression, stress, and inner turmoil. With all of these important and reputable organizations standing against conversion therapy, why are we still in debate over whether someone, especially a minor, should be subjected to it? There is absolutely nothing wrong with a gay, lesbian, bisexual, or transgender person. They are not suffering from some dangerous, dreadful, and curable disease. Even if you believe that being gay, lesbian, bisexual, or transgender is wrong, sinful, or simply a choice, I trust you are all decent human beings. You are all people who would rather see children and adolescents experience love and support. This can be achieved, but only by guaranteeing that they will receive ethical counseling with a therapist who is respectful and embraces all identities. I recently heard the term survivor